Hello friends and welcome to another episode of Better with me, Charlotte Wagerhall. You're either listening to me on iTunes or YouTube, so please like and subscribe. On today's episode, we have Kirrin, aka the Lady Dentist. She is on the show today, busting some myths about your teeth and oral hygiene. So for me, it's time to ditch the charcoal toothpaste. She's also going to talk about the safe and most effective way to both clean and whiten your teeth, and the pros and cons of straightening your teeth with different methods. It's absolutely fascinating, and I'm now hooked. So without further ado, a big welcome to the show, Kirrin. So a big welcome onto the show. We have the Lady Dentist with us. So would you like to give a bit of background about your experience, because you've been in the field of dentistry now for over 13 years?
Yes, that's right. So I graduated from right here in the Steel City from Sheffield University in 2005. So what's that, about 13, coming up to 14 years now. It's actually really nice to be back. Yeah.
Back in the Steel City.
Yes.
And you own your own practice, that's right, isn't it?
I do. So it was strange, really, the way it came about. It was never a burning ambition for me to own my own practice, but the place I'd been working for many years, the gentleman that owned it was ready to retire, and he was kind of looking to sell the practice and had a chat with us about it to kind of tell us what was going on. And I went home and had a chat with my husband about it, and I was like, oh gosh, he's been approached by a big corporate, and I don't fancy working for a corporate, and I don't fancy looking for a new job. I'm quite happy where I am. And there just seemed to be one logical answer, and that was to kind of step into practice ownership myself.
Which is incredibly rare, because I'm right in thinking that only 14% of practices in the UK are run by females.
Yes, that's right. Yeah.
And even rarer still, because your specialisms are, so obviously you've specialise in all the fields, but dental implants, which is an even rarer breed, being a female, isn't it?
Yeah, so dental implants was something that I was interested in for a while. I first started training in those about 10 years ago, and I'd go to kind of meetings and conferences and so on and look around the room, and the female dentists would be sort of few and far between, and I kind of thought to myself, look, hang on here, I know that at dental school we were pretty much 50-50.
Yeah, because it does seem to be the case. So what happens, do you think?
So I think as in perhaps many different fields, dentistry's not unique in as much as with a lot of females, life just seems to get in the way. To kind of get to sort of postgraduate level and doing more advanced procedures and more involved dentistry, there is a lot more study involved, a lot more investment required, because a lot of these postgraduate courses are self-funded, and for a lot of females it will be a case that they're perhaps more likely to work part-time, have more commitments with young families and so on, and the opportunities perhaps aren't there. So it's also something that I feel quite strongly about. The statistics tell us that just 5% of implant dentists in the UK are female, so it's something that I feel very strongly that I would like to encourage some of my female colleagues, my younger female colleagues, to be able to kind of pursue and really fulfil their potential. Yeah. And
as obviously we all have to go to the dentist as well. I think when you're going through something like, really it is a medical procedure, something like an implant. We've just got that extra caring touch, haven't we, of sort of the warmth in providing treatment as well. Yeah. And I think it would be nice to be treated by a female dentist that maybe has got that sort of more understanding and compassion when you're going through something, because you're actually, you specialise sort of in nervous patients, is that correct?
Yeah, we do. So hence kind of my handle, the Lady Dentist, because I do feel like it's my USP, I guess. There are lots of lady dentists out there, but perhaps not as many offering the type of treatment that I can do. I by no means suggest that our male colleagues are not compassionate or caring.
No,
or
not at all.
Like that.
No.
However, I do think that some people are kind of reassured by that, almost like that nurturing aspect.
Yes, that's a better way of putting it, because sometimes, we've just got that sort of extra level that might put you at ease, which has done really well for you. You're a husband and wife team, you're bossing, being a mum, having an awesome career, and it's just amazing. And sort of it's great to have you on, because with social media and all the effects and everyone I know, everyone's teeth whitening, everyone is fixated on teeth, and it's sort of come over from Hollywood and America, but they've all got pristine white teeth and we're seen as like the Austin Powers, you know, we've all got terrible teeth. And there's just been a huge rise on sort of cosmetic and just improving your teeth. So in terms of whitening, hearing it from a dentist would be great, because you see online these strips, charcoal toothpaste, you've got to swill your mouth with oil. Straight from the dentist's mouth, how is the best, safe, most effective way to whiten your teeth?
Okay, so first and foremost, I think it's really important that teeth are well cared for.
So when you say sorry, I don't mean to cut you off, but when you say well cared for from a dentist, what would maybe a dental hygiene routine look like? Okay,
so brushing twice a day, preferably with an electric toothbrush. I think that a manual toothbrush can certainly do a good job, but the reality is that a lot of us are perhaps a little bit lazy with it, or technique's not fantastic. So what I find is that using an electric toothbrush, a lot like all the other electrical appliances in our lives, let's be honest, we'd survive without washing machines and dishwashers and things, wouldn't we? But they just make life easier. And an electric toothbrush is exactly the same.
And I think for me, the fact that it's something sounds very silly when I say this, but because it has a timer on it.
It does.
I know exactly that's the time I need to clean my teeth. Yeah. In a manual, you're guessing. Yeah. And with busy lives, it's very quick to run off. And actually, it's really funny you mentioned that, because I was having a debate with one of my friends last weekend. The fact that they had a manual toothbrush, I was making a joke saying, your teeth won't be as good. In terms of the heads, I once had a dentist tell me I shouldn't be using a whitening toothbrush head all the time. That I should actually have a different one and only use the whitening one occasionally. Is that right?
Not that I'm aware of. Okay, I think with good electric toothbrushes, they are, one of the other advantages of them is that it's not possible to brush too hard, which we see sometimes. So a good electric toothbrush will be calibrated to apply the exact right amount of pressure to your teeth. Okay. Yeah. The timer, which you've mentioned, is a really good feature. The other thing that some of them have is a quad pacer. So the recommended amount of time to brush your teeth is 2 minutes, but what they'll do is just pause or beep ever so slightly every 30 seconds, just to kind of let you know that it's time to move on to another area of the mouth. So you're kind of brushing effectively and distributing your time effectively as well.
I don't think I've ever picked up on that. I think mine actually does that, but I've never really made the connections. Thank you for clearing that one up. I sound very silly saying that, but you don't think of these things every day. So toothpaste, is there a better brand? Is there a different type that we should be using, or is it all very dependent on the person? Okay, so the only hard and fast rule in regards to toothpaste is that they should contain fluoride. Okay, so which I'm glad you cleared up, because I used I'm going to call it a free-from toothpaste, the very organic types that didn't have fluoride, and I'd been using it for about a year, and when I went to the dentist from using it, I did have a filling, and they put it down to the fact that I was using that, so it should have fluoride in to keep your teeth the best out. So the way fluoride works is your enamel is made up of calcium ions. Fluoride is very similar to calcium, but it's a little bit harder. So what it actually does is replace some of the calcium with fluoride in the surface of your tooth, and actually helps protect against decay. So fluoride is really important in toothpaste. And what about flossing? Okay, flossing I would also say is important. So not necessarily floss in as much as, the string or tape that some people use. That's really useful if the gaps between your teeth are quite tight. But I do appreciate that floss can be quite fiddly to use for some people. So alternatives to floss are interdental brushes, which look like little pipe cleaners on a handle. Yes, yeah, I've seen them. And you kind of poke them between your teeth, for want of a better description. An alternative to those is flossets. So flossets are little pieces of floss kind of already strung out for you under tension on a little handle. And I like that word though. Flosset. Flosset. Sounds like a backing group, doesn't it? It does, yeah. I really like that. Flosset. Yeah. So flossets can be a good alternative to floss for people that find floss a little bit fiddly, or interdental brushes, or even something called a water pick, which is a handheld device. It looks a little bit like an electric toothbrush in terms of size and shape, but it doesn't have a toothbrush head on it. What it has is a little chamber that you fill with water and a little point on the end, and you
position that in between your teeth and press the button, and it shoots out a little jet of water in between teeth to kind of dislodge any food debris or anything that your toothbrush wouldn't be able to get at.
And so this might be not something that you do every day, but several times a week. Is that something that you'd recommend? Or?
Okay. Ideally, you should be cleaning in between your teeth every single time you brush them. Mm-hmm. Okay. But the reality of a lot of people's busy schedules is that that's not always possible. If you can commit to cleaning your teeth really thoroughly, including getting in between them and around the molars and all of that, at least a few times a week, then I think that's progress. A little bit more realistic, and it's better than just being disheartened and doing nothing at all.
Definitely. And what about the role of mouthwash? Okay. I've heard lots of mixed things about it. So some people advocate it. Some people say that you rinsing your mouth straight after brushing your teeth then gets rid of the fluoride, which then sort of is perhaps increasing the decay of the teeth. From a dentist, should we be using mouthwash? Is it beneficial?
Mouthwash is not harmful. Okay, so mouthwash isn't a no-no, but mouthwash is very much an as well as, not instead of, thorough cleaning. Mm-hmm. Okay. So I'm full of analogies when it comes to trying to explain things to my patients, because I think it helps to visualise things sometimes. So if you think of doing the washing up, okay, so you know that after you've had your dinner and your pots and pans and plates are covered in a greasy film, mm-hmm. you can run them under a tap. And you might get rid of the big bits, but they'll still be greasy. Yep? Mm-hmm. Okay. In order to get them cleaned properly, you need to get some mechanical cleaning in there. You need to get your sponge or your scour or your dishcloth, and you need to give them a scrub. Yep?
Yep.
Okay.
Yep.
So teeth are exactly the same. Plaque is a sticky stuff. It's a greasy layer. Mouthwash might make them feel okay on the surface, but it won't have removed that adhesive layer of plaque. You need to get to your teeth with a toothbrush, with interdental brushes or flossets or floss that I've mentioned already, to get at that plaque mechanically to remove it properly.
And then, so with your final stage, so that you're brushing your teeth with an electric toothbrush followed by a flossette or equivalent, followed by mouthwash, that would be the ideal dentist routine that you'd do twice a day?
Yes.
Right, okay. I feel like I need to hit the shops now. Yes. I do have floss, but I don't use it very often. I do have mouthwash, but I don't use it very often. And I think it's just because there's so many mixed messages out there. Yeah. Because like you say, you're busy, and I will do it several times a week. And I do brush my teeth twice a day, but definitely don't floss that often or mouthwash that often. Okay. So that's good to know, that one. I'm glad I asked that one. And free from toothpaste, right, that's gone. Which brings us into, so in terms of whitening your teeth, so that's good oral hygiene to get your teeth to their best. What's the best way to whiten your teeth, or the safest way? Okay,
I would always advocate seeing a dentist or somebody within a dental practice for your tooth whitening. I think first of all, it's really important to have a dental checkup to establish the reason why your teeth are discoloured. So, you know, often somebody will look in the mirror and say, "Oh, I don't like the colour of my teeth. There are marks, stains, coloration, what have you." But the reasons for those really need to be addressed. Mm-hmm. So decay can make teeth look darker. So cavities can often have a dark grey, brown kind of appearance. So you need to know whether the discoloration that you're looking at is in fact a cavity, which would then need to be treated with a filling by a dentist. Other things that can make teeth discolour are surface stains. So tea, coffee, nicotine... can all
red wine,
can all cause a surface stain build-up. It tends to look like brown speckledy marks on the teeth. If that is the case, then that needs to be cleaned professionally by a hygienist, and that needs to be removed. Plaque build-up can start to look kind of yellow or brown over time. If that's the cause of your discoloration, that again needs to be addressed and that needs to be cleaned. And all of those things really should be addressed before you can then consider actually whitening or brightening the teeth to actually change their colour. So you've got to kind of get at them first. Yep. You've got to get all the stuff off the surface.
Eliminate those bits, eliminate that. And then after that, once you've got the all clear, you've done all that, how's the best way to whiten them? Because I think naturally now we're getting more... I remember being told once that healthier teeth were actually more of darker colour when I was younger, and that's always stuck with me because I had quite dark teeth. And as I've got older, you know, this sort of selfie-obsessed generation and seeing ourselves on social media, we're getting more used to seeing these bright white Hollywood teeth, which aren't really that natural. How would you get it to a whiter level just for cosmetic purposes?
Okay. The only way that teeth will whiten is with the application of a hydrogen peroxide gel to the teeth. Okay.
So bicarbonate of soda on your teeth. So I remember doing that as a kid.
Nice try. Bicarbonate of soda can sometimes help to lift off that surface stain that I talked to you about earlier, but actual tooth colour can only be changed with a whitening gel. And a whitening gel should be prescribed by a dentist.
I was going to say, because you can buy gels online. So would that just be a smaller percentage of, sorry, what was the acid that you said?
Okay, so there is an EU ruling that says that the maximum permitted percentage of hydrogen peroxide for dental use is 6%. So honestly, nothing less than 6% is really going to touch your teeth either.
Much.
So any of the stuff that you can sometimes buy over the counter in strips and things to use, have a look at the percentage hydrogen peroxide that it contains. If some of them are 0.1 and less than 1%,
So do very little.
they're going to do very, very little.
That's really interesting. Are they allowed to sell up to 6%? Or would you only be able to get that prescribed by a dentist?
Only from a dentist.
And can you go over 6%? You can't go over 6% if you go to a dentist. That is the maximum.
That's all we're permitted to do.
And is it better then to have, if you're going for a dentist, is that where they do the trays and then you'd get prescribed the 6% of the gel and then you'd put it on at home?
Yeah, so the trick with tooth whitening is slow and steady. Okay, so we know that tooth whitening has a cumulative effect. We need to apply the gel to the teeth for realistically every day for about 2 to 3 weeks to see a significant change. So a lot of these kind of immediate tooth whitening, teeth whiten half an hour, things like that, they're not really long-lasting results. We find that actually what we're seeing is mostly dehydration of the tooth that makes them look initially a little bit whiter, but they will bounce back a lot.
And that's such a good clear up because there's so many products out there now and so many different myths, like coconut oil. Apparently, ancient Indians used to do it or something. They used to swirl coconut oil around. Apparently, that's a myth. That doesn't work, you said earlier. No evidence.
As far as I'm aware, there is no scientific reason why coconut oil or charcoal or anything like that will whiten your teeth.
Gosh, that is interesting then, isn't it? Because there's such growth in it now, particularly with like a lot of celebrities using all these different products and advocating them. But also a huge rise in where actually you can get your teeth whitened, like in the middle of shopping centres, people having their teeth whitened. That doesn't sit right with me because, you know, your teeth, to me, that you should be going to a dentist for that.
Well, I'm glad to hear that, Charlotte. I agree with you wholeheartedly. We've already talked a little bit about the importance of a dental checkup beforehand and actually establishing the reasons as to why your teeth are discoloured. And ultimately, what's more important to me as a clinician, as well as having people with attractive white teeth, are people that have just got healthy teeth. White teeth are no good to you unless they're healthy.
So true.
In the long term. So I don't have many warm or fuzzy feelings towards tooth whitening in shopping centres and things like this. I don't think that it's necessarily responsible, and I'll go as far as to say it's actually legally a little bit of a grey area.
Yeah, it doesn't sit comfortably, especially, I mean, I was chatting on the show with Sharon, who specialises in sort of, I call her the facial guru. And we were saying how uncomfortable it feels, the fact that you can go shopping, pick up a handbag, have some Botox, and then come out with some whiter teeth. It's a very strange generation. Yeah. Probably not the best choice either, which leads me on to my next one, because once you've had them whitened, we're then looking at straighter teeth.
Yes.
And there's been a huge move. So when you're at school, it tends to be that you'd have the metal train track braces. And as adults, now because we're becoming more savvy on social media and more aware of our appearance, there's been a huge rise in Invisalign, so the clear brace treatments. Yeah. So is there any benefit as an adult between the two? Should there be, you know, if people are looking into it themselves, I myself wouldn't mind an Invisalign, but I'm not opposed to having train tracks if it gives me the perfect smile that I'm looking for. Is there sort of benefits to either of them? Is there one that people, if you've got this type of tooth, you should definitely go for this one? Because Invisalign tends to be the more expensive route because of the clear benefits, and you've been through that yourself. So there was a lot of questions there, but if you can open up the myths for us, that'd be fantastic.
Okay, so Invisalign and traditional fixed braces, majority of the time, both work equally well.
Okay.
A lot of the choice in regards to which you want to go for is to do with personal preference. Okay. So the big benefit that Invisalign has is its discretion. Okay. When the trays are in, you can barely tell that you're wearing them. So, kind of train tracks traditionally as a teenager, majority of the people in your class are going to have them.
Yeah.
Everybody has them. You're all in the same boat together. It's fair enough. But as we kind of get into adulthood, people are perhaps a little bit more conscious of kind of people knowing that they're having things done and want to be a little bit more discreet and also have the resources to be able to invest in kind of themselves in a more discreet manner as well. So that's where Invisalign really comes into its own.
So, because in my head, obviously I've not been through the process myself, I just imagine that the train tracks might be quicker or more effective, particularly if you've got more crowding. Okay. But actually, both of them have very similar results.
They do both have very similar results. So there are certain limitations to what can be achieved with Invisalign. For example, people who have a skeletal discrepancy. So what I mean by that is sometimes if the jaws don't meet up properly, if your lower jaw is set back particularly or set forwards, a severe overbite or underbite, something like that, then sometimes there is a limit to what Invisalign can achieve for you. But in those circumstances, you probably should be treated by a specialist orthodontist, and it would almost certainly be a fixed brace. But 90% of kind of Joe Bloggs walking down the street who perhaps need some improvement cosmetically can be treated by Invisalign.
And is there a way of determining whether a clinic is a good place to go to for an Invisalign? Is there, or braces generally, is there sort of like a benchmark in dentistry that you should look for?
Okay, so if we're looking specifically at Invisalign, Invisalign, if you look at their website, will rank their providers in terms of volume of cases that they do. So you can look at their website, put your postcode in, and then see who close to you does the most. Okay. And it follows that, if you do more, you have more experience and you're more likely to have perhaps encountered, kind of any potential complications or problems along the way. So you've got more experience to be able to deal with anything that life throws at you, I guess. Okay.
Definitely.
The practice that I work at, we are also a member of something called the MySmile Network. So the MySmile Network is a group of elite Invisalign providers that has been specifically accredited due to the fact that we do so much Invisalign that we are MySmile accredited as well. So that's something to look out for.
So actually, if I come to consider doing it, I know the right place to go now, yes. Which is very handy. Because it's really interesting because I just thought the metal classic ones would be maybe a bit quicker.
They can be sometimes. Okay, so for those people perhaps that don't know what Invisalign is, maybe if I just explain it a little bit. So train tracks, as they're affectionately referred to, fixed braces where you have individual brackets on teeth and then a wire to connect them, which will move your teeth for you. The wire normally has to be changed every 4 to 6 weeks by the orthodontist, or changed, and elastics and things used, and so on and so forth. So big advantages of a fixed brace are, first and foremost, that it's fixed. Okay, you've got no choice. It's in your mouth all the time. It's working all the time because it's fixed to your teeth. You can't take it in and out. So we talk about kind of train tracks perhaps being more common when we are teenagers. Let's be honest, we're all a little bit perhaps more lax with things as teenagers.
It's a very polite way of saying it.
Yeah, maybe a little bit less motivated. So the fact that it's in there all the time means that you've got no choice. Compliance isn't so much of an issue. Okay. However, the drawbacks of train tracks, I shouldn't really call them that, should I? The drawbacks of a fixed appliance are that they can be more difficult to keep clean because you've got to get in and around the wires and around your brackets and so on. And then it's to do with the appearance of them as well. It can make people quite self-conscious. So Invisalign, the way Invisalign works, Invisalign is actually a removable appliance. It's a removable brace. It's not permanently fixed to your teeth. And what it is a series of clear plastic aligners. So they look like plastic trays. They're clear, they fit really snug to your teeth. And when they're in, you can barely see them. So the way that it works is that your treatment is planned by a computer from the beginning. Your teeth are scanned first of all, and then a computer package is used to simulate how we want your teeth to move. And a series of aligners are CAD/CAM generated for you. So the computer will kind of generate these aligners. They're all produced, and then we already have them at the start of treatment, and your clinician or your dentist will give them to you at various intervals.
At the start. Because I've read as well you can get them posted out. They get posted out like every 2 weeks or something, the next set that you're meant to wear, but you can actually get all the sets at once.
I think a good practice, won't just give them all to you in one go and send you on your merry way. What we would probably do is give you a couple and then ask you to come back
and
to check that your teeth are tracking, to make sure that you're not having any problems, to make sure that your compliance is good.
Compliance, that's a nice word for it as well. Yeah,
I'm going to talk a lot about compliance. So these clear plastic aligners, they are designed to be worn in your mouth for 22 hours a day. So 22 hours means pretty much all the time, other than when you are eating, drinking or cleaning your teeth. That's when you take them out.
Water's okay though, that's the one exception.
Water is the one exception, yes, that's right. But nothing else. So
if you're eating out in a restaurant, would you then be expected to clean your teeth and then put them back in?
Okay. So I guess this comes to one of the big advantages of Invisalign is, kind of we find ourselves in social scenarios and so on. So compliance. Okay. So at the end of the day, if you're not wearing your aligners, they are not working. Okay. One of the most important factors in the success of Invisalign treatment is patient compliance. Okay. If you're going out for the evening, and you're perhaps going to have dinner with friends and drinks and so on, it's perhaps not acceptable or what you'd want to do to be slipping these aligners in and out of your mouth between courses. So under those circumstances, I would give my patients a reprieve for the evening. If you're say going out at 7, you're going to be out for 3, 4, 5 hours, whatever, leave them out for the evening, as long as it's a one-off. It only happens once a week, and as soon as you come home, you're cleaning your teeth and you're going to put them back in. Okay, so that's the beauty of Invisalign, is that there's a certain amount of flexibility, but that should be an exception as opposed to...
I think that'd be the one thing that would put me off is just I think I'd be fairly compliant, because I don't think mine would be on from the consultation that I had a while ago. I don't think mine would be on for an awfully long time, and I can be if I'm... Could be quite stubborn and I will commit to it because I want the straight teeth. But I think that would be the one thing that would put me off, would be slipping out of a restaurant to sort of try and brush your teeth in a not very nice sink. And I drink a lot of coffee as well. That'd have to change. But on the good news, apparently people lose a little bit of weight while they're doing it as well.
Well, it does stop you snacking.
Yes.
So I've actually had Invisalign myself in the past, Charlotte. Yeah, and...
I mean, you've got lovely teeth. I am sat here sort of covering my mouth as we talk.
No, don't be. So I have had Invisalign myself, so I do believe in it. I know that it works from personal experience, but it is just a question of remembering to put them in. And I have been guilty of it myself in the past. I've been at work and slipped them out during the morning to have a cup of tea. Now, luckily for me, I work alongside a very motivated dental nurse that will give me a shove and say, "Have you put them back in?" and remind me. And I got through it that way. But hands up, I'm guilty myself. So Invisalign is by far preferable for most adults because of the flexibility that it has, and because of the fact that it is so discreet. But really, it does boil down to how motivated you are
to do it.
Yeah.
And once you've had it done, I did read, can you confirm whether you're meant to then sleep in your retainers for the rest of your life every night?
So I'm really glad that you asked me about retainers, because this is an area that's really important to discuss. And you asked earlier as well about choosing a clinic. So I think that one of the important things at consultation is to really listen to your dentist and Ask them about retention as well. And when you're getting your quote for treatment, find out whether or not retainers are included. Okay, so up to...
So some places wouldn't include a retainer as part of the...
They may charge you extra for a retainer at the end.
Right, okay.
So, for example, at our clinic, because we know how important retainers are, we will include your retainers at the end of treatment as part of your case fee. And we also include tooth whitening as well. We will provide you with some gels to use, as we mentioned, kind of 2 to 3 weeks of wearing gel in some specially made trays for an hour or two a day.
And would they be different trays to the ones that you use to keep your teeth in place?
Ideally.
Ideally,
yeah. Okay. And the reason for that is with the trays that keep your teeth in place, retainers, okay, they don't overlap onto the gum at all. Okay. Whereas with a whitening tray, ideally we want it to overlap on your gum ever so slightly. So we've got a seal against your saliva, and your whitening gel then isn't diluted while it's working at all.
That makes sense.
Yeah, whereas if you're using your retainers to whiten your teeth, it's okay, but you might find that your teeth are a little bit more stubborn along the gum line because the whitening gel has been diluted out a little bit by your own saliva.
So it's just good to ask these things. You don't always know these things, and I don't think that's necessarily something that would be perhaps spoken in all clinics, unfortunately. And that really surprises me that perhaps it would be an optional extra to add on a retainer at the end, because if someone's already spent quite a lot on their teeth, that could be something, if they don't understand just how important it is to have a retainer, to have an optional extra. I can imagine a lot of people saying, I've already spent enough, it's fine, but actually that should be something that's a non-negotiable.
Absolutely.
Like if you want to keep your teeth straight, you need these, and yes, it does cost more, but if it's you're only going to be coming back again in a couple of years or months for retainers otherwise.
Okay. To put things into context for you, up to about 40% of the patients that have Invisalign in my clinic are people that had orthodontic treatment, braces, as a teenager, and their teeth have relapsed or moved back. Okay, so that gives you an idea of the prevalence of orthodontic relapse and what a big problem it is in the adult population.
Gosh, that's huge, isn't it? Yeah. And I did want to actually cover today about veneers and implants, but we're actually coming up to the time there. So I just wanted to cover really quickly the difference between a veneer and an implant.
Okay, so the two have a very different function. A dental veneer is something that is used to improve the appearance of a tooth. Okay. So think of it as a false fingernail. Okay? Yes. It kind of sticks over the front surface of your tooth. So it is used to improve the size, shape, position or colour of a tooth. A dental implant is something quite different. A dental implant is a phrase that is used to refer to something which is embedded into the gum first of all, and then it is used to support a crown or a cap or a bridge or whatever restoration we need. And dental implants are really used to restore missing teeth.
Okay, so an implant would generally be one where veneers tend to be multiple and implants tend to be more for medical grounds, perhaps, rather than veneers, which are more for a cosmetic ground.
Yeah, veneers are pretty much a cosmetic treatment, really. Okay, so veneers are bonded over your own natural teeth. Dental implants are a way of replacing teeth which have either had to be extracted for some reason, or some of the patients that we see are people who've had some trauma. Lots of people kind of falling off bikes and sports and things like? And sports and things like that, or people that have had to have teeth extracted for other reasons. So dental implants restore missing teeth.
And are you having an influx, I will say, because it's now quite... I don't know if quite common's the word, but people seem to be going abroad for cosmetic dentistry. So there was Love Island on in the summer, and Jack, one of the stars, I don't know if you saw it, he spoke very openly how he went to Turkey to get his veneers, and he's got these huge white teeth. And obviously that generation that watch are quite vulnerable. And are you seeing an increase of having to correct dentistry from people that have gone away for treatment?
Unfortunately, Charlotte, yes. It saddens me really that, kind of people value their dental health so little that they will allow people who perhaps, you know, don't have the same rules and regulations or standards that we work to here, or the same fallback, really. Ultimately, I think that in a lot of these places where there's a lot of dental tourism, there will be very talented clinicians. And I don't think it's fair that I tar everybody with the same brush. However, I know that if I were to see a patient for veneers, the overall process from beginning to end would take at least a month. Okay. The reason being, we'd have a very detailed consultation process about what their expectations are, kind of size, shape, colour, what they're trying to achieve and so on. I would then fit a prototype or a trial smile where the proposed size and shape of the teeth is transferred to your mouth in plastic first of all. And then you go away and you trial it for a couple of weeks and you come back and you can tell me whether you want this a little bit longer, shorter, you want this edge a bit more rounded, you know, kind of, we can tweak things a lot. Then I will have your veneers made. Then you'll come back and have them fitted. Then I'll see you a week or two afterwards to make sure that everything's okay and there have been no problems and you know, kind of any final tweaking. So the process takes at least a month to 6 weeks, realistically, if it's going to be done properly. I just don't see how that can be done within a week.
Okay, you just said it there. I mean, it was just interesting to see if that you've seen a rise, because I've seen a rise in the media, and whether actually that's trickling through to the general population rather than just celebrities going abroad for it, but you have, sadly. So, but thank you for busting a lot of myths there, because I think this is an area where, particularly when you go to Google, there's a lot of different information that's conflicting. So I now know that I need to, floss, Charlotte, make sure you've got the fluoride, don't go for the free from, make sure you're using mouthwash is absolutely fine to do that after you've cleaned your teeth as well. And basically you get what you pay for. So go to the right place, check someone that is accredited, that are in, is it this Smile?
So the My Smile Network for Invisalign. And, you know, tooth whitening, anything to do with teeth is considered legally the practice of dentistry. So if somebody touches your teeth, the law in this country is that they need to be a registered professional on the General Dental Council register.
Which is very interesting, because a lot of sort of more beauty salons, beauticians, and again, I'm not trying to discredit anyone, seem to be offering more services to do with teeth and teeth whitening, and actually
it's certainly a legal grey area. Yep.
I'm glad you cleared that up. So it basically, go to a dentist, guys. Look after those teeth. You might not have to go and get them professionally whitened if you just look after them properly. So just finally ending on, what is your formula for success?
Okay, professional or personal?
Either or both.
Okay, so professional is happy patients, okay, and job satisfaction. So listening very carefully at the start in regards to what somebody's expectations are, and having a clear idea of what the goals are, and then helping them get there. Okay, so, you know, I can always pat myself on the back and say it's been a good day at the office when I've got somebody that will just kind of stand up and say thank you. You know,
brilliant.
I'm pleased with my results. You know, we had fun getting there, and I'll see you again for my checkup in 6 months. So that's my professional success.
And personally, because obviously you're a mum as well, a wife.
So personally, I think it's really important to have a good work-life balance. You know, I'm very fortunate in as much as, because I do work alongside my partner, it gives us a lot of flexibility with our children. I do work part-time clinically, so I have, you know, a couple of days of doing the school run and being at home and everything. I've got girls that are 5 and 1, so it's all fun and games at home as well. But really kind of keeping an eye on both aspects of my life, really.
It's busy, juggling it.
Yeah, enjoying my career and enjoying being a mum.
And doing it very well. So how can people find you on socials?
Okay, so I'm at The Lady Dentist on Instagram, and my practice is at the Fresh Smile Clinic on Instagram and on Facebook. And our website is www.freshsmileclinic.co.uk.
Thank you very much. And I'm now off to the shops to go and buy extra teeth cleaning apparatus and a flossette. It's my favourite thing I've learned in the whole show. Thank you very much for coming on. And next time you see me, hopefully I'll have less Austin Power teeth.